Liver Day, of course, somebody has written, be vigilant, do regular liver checkup. Fatty liver can affect anyone. This is the theme of the Liver Day in 2023, presentation of the liver transplant. And you must be aware that we are accredited with the liver transplant and we have a tie-up with MGM. And Dr. Suresh Garu is one of the part of the time, and we are shortly starting. We have already ordered for the QSA, which you saw that, and we are shortly starting the liver transplant program at Virenchi.
Lot of people suffer from this problem. There are a lot of at-risk populations, and in many of the cases the problem is under-recognized. It's detected at a late stage. It causes a lot of cost both to the healthcare provider and to the patient, and delays can lead to a lot of complications. So in India, we have 5 types of hepatitis viruses: hepatitis A, B, C, D, and E.
Why the liver disease, even it has been a very morbid disease in the previous past decades, but has become now very much controlled with advances, sophistication in medical technology from a team of doctors or a team of specialties involving physicians, gastroenterologists, hepatologists, surgeons, physicians, intervention radiologists, endoscopists, all making its overall success in its management. So in that, where surgery is fitting and how it is contributing to the overall success, I'll try to highlight. So as we are stressing that liver is vital because it is a powerhouse. It's generating the energy which will supply to all other organs, even the bones, even the brain, even the heart. So without energy, nothing is there. So no finance, no insurance, nothing will be there. So now with the imaging has become more sophisticated, we understand the intricacies of overall liver pathology so that we can plan. So even from the simple ultrasound, which can be as a screening to detect the lesions or problems in the early stages, to the advanced PET CTs, laparoscopic, and endoscopy, ultrasound, ERCPs, MRI. This will help us to look at exact pathologies going where is this liver cell or bile duct cell or draining systems or vascular system, where it is there, we can exactly pinpoint the lesion and plan treatment accordingly. So this is the difference. The simple liver cyst because of higher cyst can be diagnosed. Otherwise, in previous decades, we need to do so many other allergic tests and also. Now even the malignancies, everything, we can accurately diagnose it. Even now, for SCC, there is no need to do a liver biopsy. That liver imaging itself is sufficient to go for a diagnosis, and based on that, definite treatment can be planned. So non-invasive way of diagnosing has become a part of liver imaging. Now especially the CT volumetry, after it has come, it has revolutionized the liver surgeries. We can literally dissect the liver in the CT console itself. We can plan where is the lesion, what is the extent of the lesion, and which vessel is feeding, which vessel is draining. We can accurately locate it, and during surgery we can accurately go that part and attend it without any much extra dissection and reducing the trauma of the surgery. So here the CT volumetry, even the vascular drainage, arterial drainage, the portal venous drainage, the hepatic venous system drainage, everything can be visualized with a color volumetric assessment, and we can look at the lesion, which segment to be resected.
So this is the segmental anatomy of the liver. We all know caudate lobe is 1, and then left side 2, 3, and then 4, 5, 6, 7, 8. Few of the part like 7 and 8 are the posterior segments. The beauty of liver is that if you remove a segment, it works like a functional unit, and even the research are going on that maybe someday, with the help of growth factors, will able to transplant a single segment of the liver to the recipient, and with the help of growth factor, it can become good enough to take the responsibility of the metabolic function of the whole body. Of course, this is still a dream, but still, dream only leads to the realizations. So these are the function of the liver. We all know it has multiple metabolic function: gluconeogenesis, hormone metabolism, synthesis, ketogenesis, storage function. It basically stores glycogen, vitamins, iron and copper, and it produces coagulation factor. It has circulatory functions. So all these we are aware of. So now I'm coming to the real topic, the transplant. So the normal liver looks like a pink. It is spongy, it is soft, but when there is a cirrhosis, it is deformed, it becomes firm. And what are the indication why a person is going to need a transplant? So it is when there is a liver cirrhosis is advanced, or in cases of acute liver failure, some metabolic liver disorder or some other metabolic disorder can also lead to dysfunction of the liver, or they lack some enzyme in the liver which leads to the dysfunction of the other part of the body, and they can also get cured with the transplant of the liver.